Hello, I'm Dr. Sam Goldhaber, and I have the privilege and pleasure of being president of the North American Thrombosis Forum, NATF. We are now about to host our 7th annual Thrombosis Summit. This is clearly the major educational event of the year, and it gathers together clinicians, including physicians, nurses, and pharmacists, patients, their families, members of the pharmaceutical industry, and other healthcare providers, all to get dialogue going among ourselves about how to improve healthcare in thrombosis-related diseases. And I can tell you, over the past year, we've made tremendous inroads and progress and improvements that were really almost not even dreamed of 7 years ago. This is a very special summit because what we've learned these past 7 years is that the major thrombotic diseases are really all interconnected, and these include acute coronary syndrome, which is responsible for myocardial infarction and angina, stroke due to atrial fibrillation, and deep vein thrombosis, or DVT, and pulmonary embolism. All of them have a pathophysiologic basis in inflammation, and all of them involve the formation of blood clots where essentially our bodies, in an effort to protect us, are paradoxically going awry and forming too much of a good thing. And one aspect of the Thrombosis Summit this year, our 7th year, is that we are going to cover all 3 areas: acute coronary syndrome, stroke prevention in atrial fibrillation, and DVT and pulmonary embolism. And the summit is going to be highlighted and featured with our 2nd annual Arthur Sasahara Lecturer in Thrombosis. Dr. Sasahara is a member of the board of directors of NATF, but more importantly, he's actually a mentor to me and to all the other sitting members of the board of NATF. And in his honor, actually for his 85th birthday last year, we created in perpetuity the Sasahara Lectureship. Last year we had Dr. Peter Libby speak on atherothrombosis, and this year we are fortunate to announce that Dr. Marc Pfeffer, world-renowned expert in cardiovascular medicine, is going to speak on the linkage between heart failure and thrombosis. In addition to the morning summit on Saturday morning, the last Saturday in September 2014, we're going to have a very innovative afternoon program that is patient-focused, that will have plenty of time for patients to ask questions, and there'll be quite practical issues that come up. I'm going to have a seminar on how individuals can help take responsibility for their own care to minimize the chance of developing DVT or pulmonary embolism. And a lot of the effort that can be done on a personal basis has to do with improving lifestyle, having a heart-healthy lifestyle, eating heart-healthy, and exercising in a conscientious, if possible, daily manner to improve the metabolism and lower the risk of DVT and pulmonary embolism. And we'll also discuss in my afternoon seminar issues related to various medications such as aspirin and oral anticoagulants. My morning talk is going to focus at the Thrombosis Summit scientific sessions on risk stratification of patients with atrial fibrillation to identify those patients at highest risk of developing a stroke and how we can intervene with anticoagulation and really markedly reduce their likelihood of suffering a stroke, which they might otherwise be susceptible to. So it's going to prove to be an exciting program. Saturday morning, the scientific session. Saturday afternoon, the patient-oriented session on our thrombosis weekend at the elegant Fairmont Copley Plaza Hotel, the venue so far for all of our thrombosis summits. So we welcome you. I will say that you should register now on our website homepage. Spacing and seating is limited, and I look forward to greeting you at the NATF Thrombosis Summit. Thank you very much.